Hi everyone, I'm back. There were a lot of people asking me, where can I get this medicine? Where can I get that medicine? And these were just the common medicines for fever and for cough. These were regular, simple medicines that we take for granted every day. And at that point in time, we couldn't get them. So you could see here how vulnerable our system is. Right now we're thinking, hey, our system is like, it's like every day is running just like the day before. Everything is very typical. However, when you have things that happen like COVID, some crisis like this, suddenly the things that we enjoy every day, things that we are available every day, normally just go out and buy, we don't have it. We can't find them. And at the height of this, when this was happening, a lot of people were buying medicines from unknown sources, and many of these were probably fake medicines. I remember someone who wrote to me on a Viber chat group, and he was saying, I purchased this medicine from somebody on Viber, and he was saying the color was different and the packaging seemed to be different. I think it's fake. So he returned it, and he discovered that many other people in his community also returned their medicines. And good for them that they were able to detect the fake medicines. Now, how do you know if your medicines are original? Fake medicines are very dangerous. We don't know what they contain. At the very least, they could have contained the same medicine, just that they were just branded differently. At the very safest would be it's medicine. It just contains flour, probably. But at the very worst, it might actually contain something that is poisonous or dangerous to you. Fake medicines are technically very dangerous because we don't know what is inside them. Now, just to let you guys know, I have a talk tomorrow, January 27 at 8:30 p.m. I'm going to be live streaming the talk in a private Facebook group. So if you want to see my talk, this is all about how to control asthma without medicine, how you can control your allergies without medicine. So you don't have to worry about purchasing what you're purchasing is fake or original. You don't even need medicine. Just type I want at the comment section below to get invites to my talk. Also, if you know anyone with asthma, please invite them to my talk. Share with them this video. Alright, so let's begin with our main topic today. Are your medicines original? Okay, so you'd see here, this is a news article. It was talking about what the fake and the original paracetamol brand Biogesic looks like. Now, this is good because the brand, this company has a reputation to protect, so they do issue these guidelines to help people determine whether the product is fake or not, or original. No? So first of all, you would see that the fake one has a different color. So depending on the sources of the fake one, remember that authentic medicine only has one primary source. The main manufacturer is the main source. However, when you talk about the fake ones, they could come out from different factories. One could come from China, the other one could come from India, I don't know, no? So they would come from different places, no? So you notice here that, well, this one is darker, it has a bright orange color. This one has a pale pink color compared to the originals. The other one is that the markings on the original is consistent. Here it says 500, and on the other one has the word Biogesic on it. Whereas the fake ones, we don't know what that they're going to put there. They can put all sorts of stuff. Number 2 is on the packaging. You notice here that in the packaging, the fake one has a lot of air, no? So apparently the packaging material here was not designed for this particular tablet. Whereas the original one, the authentic tablet, you would see that the packaging is quite well fit into this packaging. Thirdly is the pattern, no? the diamond pattern. So they have the aluminum casing, and the way it was stamped looks different on the original one. They're both patterned. They're both diamond shaped, but the one here is somewhat different. Other changes is the word, the lot number. The lot number tends to be a bit blurry in the fake ones, while as the original ones, the lot numbers are very clearly seen. And also the Unilab seal is different. The Unilab seal is different in the original and on the fake one. So these are some of the differences. Very important that you get to know where is the fake and real medicine. Now, what if you're dealing with other brands? Now, so you will have to look up the the comments from these other manufacturers to see if they have issued anything that will guide you to determine whether their medicine is fake or not. How about those unknown brands or the generics? There are manufacturers here, they don't even put names anymore. They don't put brands, they just put the active ingredient, and then they sell it off as generics. Well, you will be on your own to figure out if it is original, if they are authentic or not. Even the plain generic ones have fake versions of them, and the fake versions of them can proliferate because the manufacturers are harder to come by in some of these. It's harder to trace. All right, so wish you well. Do make sure you buy your medicine from reputable sources. All right, now there are people who have been caught selling fake medicine. Like here in Sunstar, they were saying in Bacolod there was an establishment that was caught having fake medicine. All right, now just as a trivia, do you know that we don't really know or we haven't agreed on how paracetamol works? Paracetamol is the most prescribed medicine, perhaps the most taken medicine all over the world. And here in the Philippines particularly, if you check out our book on paracetamol, on medicines, the listing of all the medicines, you would find that paracetamol has the longest list of manufacturers or sellers. That's because it's so popular, everyone wants to sell it. As soon as you bring it out, you're sure people will buy it, you know. And yet we don't know how it works yet. No? When you talk about antibiotics, for instance, we can tell you precisely what enzyme the antibiotics would block out. The other pain relievers, we know exactly what is the pathway, what chemical it acts on, and all that. Yeah, okay, I'm back. So paracetamol, we haven't actually figured out how it works, yet it is consumed all over the world and it's very popular. So that's the story of paracetamol. So there is an article from the news group The Guardian, and they were mentioning a study where they found that paracetamol doesn't just dull down your physical pain, it actually can dull down your emotions as well. So this might be particularly one of the things we have to watch out for when we're dealing with a lot of pain relievers. You notice nowadays depression it's been everywhere now. A lot of people are talking about it. Okay, I'm back. You see, the problem with these medicines, these pain relievers, they might be able to dumb down your emotions that make you happy. So if you are, a lot of these medications might be precipitating things like anxiety and depression. So this is why I also try my best to keep medications as low as possible, or try to remove people from taking a lot of these medicines as soon as possible, or as soon as capable, or I try to find them alternatives for medication. So one of the alternatives I do is the Buteyko Method, and I'll be giving a talk about it tomorrow. So type I want in the comment section below to get invites for my talk. Now I'd like to thank Miss Mel from Gramworth Enterprises. She sent me these packets of instant cacao drink while I was having COVID, and I'm very excited to try them out. The packaging says it comes from South Cotabato, and this is the original flavor. So I have this morning we tried one pack over here and we mixed it up, and it looks somewhat like this when you mix it up. So I'm very excited to try it out. So while you guys let's see what it looks like. We put it here and you can see that it contains quite a lot, right? It contains quite a lot in this container. Then let's add some hot water into it.
Be careful not to spill.
Alright, I'll be careful. There, alright, so you put it here and we mix it just a little bit like this, and it melts very fast. Now my problem is I can't really drink hot drinks. When I drink them, my mouth seems to burn up. So let's put a little bit of ice. Some people, when I go to the cafe, some of the people, the baristas are kind of find it a little strange. I order hot coffee and I put ice, just a little bit of ice to make it cooler. That does taste very good. It's unsweetened. It's unsweetened, but it's not too sweet. Very good. Very good. Thank you, Miss Mel from Gramworth, for sending me this. All right, so now I have a talk tomorrow, January 27. Please type I want down below and I'll send you invites. So now we're gonna go to the beefier part of this discussion. I will be answering your questions, and let's take a look at the questions for this week. First question from Andy. Kompleto ng bakuna ang anak ko na 5 years old? Totoo bang mataas ang case ng myocarditis ngayon? Well, now what we have to look at here, Andy, is what kind of vaccines are implicated in causing these myocarditis. Right now, I think the only one, the only vaccine that's really seemed to have a controversy regarding this are these the COVID vaccines that are using the mRNA vaccines. No, now the country that has the most number of vaccinations or the highest percentage of vaccination is Israel. And in a study in Israel, they found that the incidence of myocarditis is 2.13 cases for every 100,000 persons. And it was highest on those who had 16 to 29 years of age. So they didn't say whether children had it, mostly because in most countries we haven't been giving the COVID vaccine for children yet. However, for these who have it at 16 to 29 years old, they were mild and they usually just disappeared after a while. You don't have to worry at your 5 years old because here in the Philippines, at least, we haven't given COVID vaccines at 5 years old yet. So, yes, the mataas ang case ng myocarditis, I wouldn't say mataas, but yes, there is rumor that there is some sort of link between them. So, it's a good thing that they're not dangerous yet, no? Okay, from Shasha, the question is, hello po, tanong lang, Avamys and Betadine nasal spray, pwede bang pagsabayin? Alright, so before we continue answering this question, we have to figure out what are these. Avamys is a steroid that you spray on nasally, and we usually give this if a person has constantly having allergic rhinitis, nose is constantly clogged. So we give this, and what the steroid does is it sort of reduces the sensitivity of your of the nasal cells. So yes, 0, ayan na, nag-yellow na. Oh, I'm back. Thank you everyone for some slight technical issues. All right, so Betadine nasal spray is quite interesting because Betadine is known for their povidone iodine products. Povidone iodine, Betadine, you put it here, there's also a gargle and all that. So what does medical experts say? Well, first, there is a warning in using Betadine as a nasal spray and as a mouthwash to prevent COVID-19. Apparently, the Betadine is very good at killing COVID-19 if the virus is already inside the nose. So if you already have mild or moderate COVID-19, then it comes out as pretty useful. However, if you will use it to prevent COVID-19, remember that iodine is an important aspect that is used on the thyroid metabolism. And so if you keep exposing yourself to all this povidone iodine every day, you keep putting iodine, you will have a increased risk for hyperthyroidism or a thyroid problem. No? In fact, this was noted by the Journal of Otorhinolary and Nasal Surgery, that they noted that up to 29% of people who would use the Betadine, povidone iodine frequently had thyroid disorders, because this could cause a problem, really. So yes, it can kill. Most probably, it can destroy the virus, but you cannot use it every day for extended periods of time because of this risk of developing a thyroid disorder. Remember that although you are putting in very small amounts, you're not absorbing a big amount. You are only absorbing a tiny fraction of the amount when you use these things. The problem is you might be using it every day, and so that could be enough to bring up your iodine to a level that's not very good, no? Now, as a trivia, you might wonder, why is it povidone iodine and it's not just plain iodine? Well, iodine by itself actually exhibits stronger antibacterial action than povidone iodine. The problem with the plain iodine is it can cause very bad irritation on your skin. So drug companies combine this with povidone to make it povidone iodine so that it doesn't irritate your skin as much. But yes, it does irritate your skin, even povidone iodine. So after you use it for disinfecting, make sure you remove it. You remove it. Don't keep it on your skin for a long time because it can cause skin irritation. So same with your mouth. If you gargle it and leave it there all the time, imagine the irritation that it might cause your mouth. Now, the thing here, this article that I took here, this talked about Betadine as a nasal spray. Because you might have people who might get Betadine itself, the solution, mix it with water and spray it into their nasal cavities. This is not how it's supposed. This is not what Betadine nasal spray really exists. The real Betadine nasal spray is this one. So you can see here, the real Betadine, Betadine nasal spray is not povidone iodine. It's Carrageenan. No, what particular type of Carrageenan? Iota Carrageenan is the particular one. Now, this Carrageenan was studied, and it seems to be able to prevent some colds. Yes, it seems to be able to have exert some effort on the colds caused by the colds virus. And a recent study wherein they took 394 people, randomized into two groups, and they used the they used the Carrageenan spray on one group. It seemed to have a positive effect on slowing down COVID-19. So yes, you could use this for COVID-19. It is being used for colds, and it's made of Carrageenan. What is Carrageenan? Carrageenan is a type of seaweed. For those of you in down south in Iloilo, you might like this, no? It's very good tasting Carrageenan. And this is a very nutritious product. And this product here, the number one producer of Carrageenan in the world is the Philippines and Indonesia. The Philippines was the very first one to make it commercially cultivate this stuff. Now, Carrageenan is used in a lot of food products, from your ice cream all the way to hot dogs. You find Carrageenan because it makes a very good gelatin and thickening agent. But you know, Carrageenan also has a secret. It can make your food taste much better. They say, like, give it this umami taste. So long time ago, until now, a lot of Chinese chefs, they would use Carrageenan into their soup, the Chinese soups, to make it taste better. And so there was this Japanese scientist who started to wonder, what is it in Carrageenan that makes food taste better? And so he was able to do a lot of experiments, and he was able to isolate that particular substance in Carrageenan that makes food taste better. And what was more interesting is he found a way to isolate the same chemical in Carrageenan from a different source. He was able to get them from sugarcane. And so this guy was able to get the same chemical that makes Carrageenan food taste very good in Carrageenan, and extract it from sugarcane, which is much easier to harvest than Carrageenan algae. And this guy, can anybody guess what this name of the guy was? Can you put it down in the comment section if you can guess the name of this this scientist? Okay, I'm gonna tell you guys. The name of this scientist was Dr. Ajinomoto. So that's why this product is flooding our supermarkets. That's because that's the product with his namesake, Dr. Ajinomoto, and he was the one who was able to isolate the monosodium glutamate from Carrageenan and determined that it was the monosodium glutamate that gives that umami taste. All right, so this is just a trivia on the Carrageenan spray. So now this going back to your question, yes, for the question on is it safe? Let's go back here. Yes, is it safe? Can you combine Avamys and Betadine nasal spray? Right now, I haven't seen any literature that says that you cannot do it. So, in general, that probably say that it's probably alright to combine them. However, I would recommend that you space them apart. You spray the first one about 30 minutes to an hour before the next one. So in this case, at least the first one has been properly absorbed before you take the next one. Because many of these medicines, when you combine them, we don't exactly understand yet or there are a lot of interactions that we don't understand. Like for instance, your body might absorb one medicine faster when it's combined with another substance, or it might combine them slower. It might absorb it slower. So there will be some changes. So for best results, I would suggest that you separate them. Yes, pwede mong pagsabayan, but I suggest ihiwalay mo to get better results. Put them at least an hour, 30 minutes or an hour apart para mas maganda. Mas sure tayo sa results. Alright, so from Shasha, thank you so much for asking this question. Let's take a look at the next question. The next question. Ano kasi bahing ng bahing yung sa mga mata niya, sa may eye bags medyo itim siya. Dahil ba sa allergic rhinitis yon. So you have eye bags over here. So this is what we call allergic shiners. Allergic shiners. This allergic shiners. So you see this boy here, he has these red lights here. Now allergic shiners, they are commonly caused by allergies. They're pretty harmless, so you have to get rid of the allergies to remove that. That's caused by the blood. When your you have your nasal your nose is congested, the blood ends up going here, and they end up going. They get to pull out there. But other things that can cause this, of course, is sleeping extra late. So if your son is not sleeping on time, because nowadays everyone has gadgets, they don't get to run around anymore, and they end up sleeping really late, and they wake up on a different time. You could also influence that and cause that, no? So please get them to sleep early. And yes, it's allergic shiners, and yes, you are right, it is because of allergic rhinitis. So the best way is to get rid of allergic rhinitis, and we will discuss on another question later. There's additional question. Martin asks, Carrageenan was offered for my gut, doc. Now I only take fresh unpackaged foods talaga. I never buy anymore from the supermarket. Thank you, Martin De Luna, for this comment. You know that Carrageenan has been identified as a gut inflammatory agent. And in fact, there are some moves in some countries. I think the European Union, they want to ban Carrageenan. This is pretty bad for our food industry. In this industry, if they do ban it, we will have to look for some alternatives. However, Carrageenan is for many vegetarians, Carrageenan is their source of gelatin. Gelatin is made from meat. So a lot of the vegetarians, they are turning to Carrageenan as their source of gelatin. But yes, Carrageenan is considered a gut inflammatory agent. So yes, it could inflame your gut and cause gut problems. Thank you so much, Miss Martin De Luna. So you may want to consider that. Will it cause nasal irritation? I don't know yet. It's my first time to see the spray on the nose using Carrageenan. So we will see the results of this after many years if this product becomes very popular and a lot of people use it. That's the only time we will get to see whether it can cause nasal irritation as well. All right. So these are allergic shiners. There you go, and you can get them at any age. Okay, from JB, she asks, Good AM, ano pong magandang gamot sa allergic rhinitis? 13 years old din po. Di na nakukuha ng cetirizine, pabalik-balik na po. Now, JB, I will categorically tell you, walang magandang gamot sa allergic rhinitis. Walang magandang gamot. All these medicines, you see, the main problem with allergic rhinitis is you have to stop the cause of the allergy. So what is it in your house that's causing the allergies? Is it the dust? Is it these things? You have to remove it. Is it the food? You have to figure out what causes it. Number 2 is there is a way to stop allergic rhinitis naturally without medicine. And ito lang yung maganda. This is the only thing that worked. I had allergic rhinitis for years and years and years since I was a child. I would wake up, my nose was always clogged, and I went through all these medicines. I discovered a way to clear it up without medicines. And this is why I teach the Buteyko Method. Martin Luna says molds po. Yes, molds in countries that yes, molds is a big cause of allergic rhinitis. I'm surprised here in the Philippines we don't talk about it so much. But you watch TV shows like House MD, for instance, and they talk about molds causing all sorts of problems in their place. Yeah, so yeah, here it's not as a big problem. I think perhaps because it's mostly hot here in the Philippines. It's humid in Manila, but we don't see as much molds being blamed for as many problems. But yes, you do have to remove whatever it is that's causing your allergy. You can put up a air purifier. You can make sure your house is nice and clean. And then I would recommend that you teach your child to use the Buteyko Method so that your body will stop producing the excessive histamine levels naturally. This is the only good way I can really recommend. Otherwise, if you don't attack the main source, you are just forcing your body to go and try to fix a problem. Your body is just trying to adjust to the problem, and you're just trying to manipulate your body to adjust to it. in an unnatural manner. So yes, although cetirizine, I haven't seen any long-term problems with cetirizine yet. As this moment, we haven't had any any reports of cetirizine causing any severe side effects. I still would like the only thing na only magandang gamot is to go to the source, which is get rid of the allergies and learn how to control the body naturally so that it doesn't produce the histamines that's causing the allergies. So JB, thank you for this question. Yes, all right. Next question from Ray. Good afternoon, Doc. Can you suggest a rehab plan for asthmatics who are still reeling from the effects of COVID, like excess phlegm, shortness of breath, and among other conditions? This is called Martin De Luna mentions, Doc, I found for me that banana activates histamine for me, but it's not for all naman. Yes, Martin, you're right. I have encountered, you're the very few people who have complained of asthma or allergy on bananas. Now, if you're talking about bananas, Martin, you have to take a look at what kind of bananas you are taking in. Now in the Philippines and in banana growing regions, there is a type of banana that we export, and this is your Chiquita banana. These are the big ones and they're not as sweet, but they are exported, number one, because they're big. Number two, it's possible to make them really look nice, not without the black spots. And number three, they can last the journey to go to Europe, to other countries, and to the United States. So these are the bananas frequently being exported. Now, these countries that are receiving these bananas, they don't like it, and if these bananas have any insects, if they do, all the bananas from this country will get banned. So what the banana growers do is they have these airplanes spraying insecticides on all these banana fields that grows this Chiquita banana. So if you are allergic to bananas, you have to consider, maybe number one, it could be the insecticides used on those bananas. And the bananas that have the worst, that have the most insecticides, would be your Chiquita bananas, because they're the ones being exported. A lot of the local bananas, your Lakatan, Latundan, your Saba, no, you notice that sometimes they don't even look so attractive in the market anymore. They have lots of black spots and all. But many of these are the ones that didn't use up a lot of chemicals because they're not exported, no. So Martin says, yes, Bob, for me, what doesn't cause problem is Saba banana. Yes, precisely, because it could be the insecticides that is used on those bananas. So be careful. I personally, I can't take, for instance, if I take pineapples, certain pineapples also make me itch, and eggplants, they also make me itch. And when I went to Africa, I lived in Africa for almost a year, and I was taking their pineapples there, I didn't get any itchiness. I would take their eggplants, I wouldn't get any itchiness. And apart, it's because of the insecticides that we use here for our pineapples and our eggplant. So if you can find bananas that did not use insecticides, you might find that you won't react to them. You won't react to them as much. Yes, thank you, Martin, for commenting. Yeah. So again, let's go back to Ray's question. Can you suggest a rehab plan, no, for those reeling from the effects of COVID, especially for those who are asthmatic? You know, the problem here is I haven't actually encountered anyone coming up with a rehab plan. This is what we call long COVID, and even after you recover from COVID, if the fever is not there, a lot of people still they still have the insomnia, they still have the coughing, they have these problems, and this is a serious problem, and this has been discussed among us Buteyko practitioners, even abroad. We have seminars about this. And what I have noticed is that when I teach people to do Buteyko method, people who suffer from long COVID, the long COVID actually subsides and disappears. So it's very interesting, and I'm quite convinced that many of the symptoms of long COVID could be brought about because of hyperventilation. When I look at the symptoms of hyperventilation and I look at the symptoms of long COVID, they're actually very similar. In fact, they're practically the same. So when I use the treatment of hyperventilation, which is Buteyko method, I teach people how to control the breathing, to control it well, the symptoms disappear. For most of the people I've taught this to, long COVID disappears. So this is a very good effect. So I think for the rehab plan, the one I can really recommend is the Buteyko method. So 1 out of every 10 Filipinos has asthma. So that could also translate to 1 out of every Filipino who has COVID, perhaps, no? So if you know anyone with COVID, 10 people who had COVID, chances are you know somebody with asthma who's had COVID. Yes, my breathing camp is the best way to learn the Buteyko method. I incorporate other techniques aside from the Buteyko method in the breathing camp, and I've made it in a process that's easy to understand, easy to learn. It's been tried and tested all over the world. So the Buteyko method will teach you, it's a system that will teach you how to listen to your body so you can change your breathing and you can do things accordingly. And it can help you out with your asthma and your allergies. And it can help you naturally without the use of medicine. So many of my students have been able to reduce or even stop their use of medicine. So again, to know more about the Buteyko method and my breathing camp workshop, please type "I want" on the comment section, and I will give you invites to your free talk for tomorrow. So please, I hope to see you. Type "I want" in the comment section below. I'll send you invites. If you know anyone who has asthma, allergies, please share with them this video. Please invite them to my talk tomorrow. I'm Dr. Charles Edward Sarando. I want to thank you for your time. And again, next week, I'm going to have another Q&A session with all of you who want to ask questions regarding these topics. Thank you so much, and I'll see you. Have a great day.